promotion of comfort. Common causes of discomfort for new moms include after pains, lacerations and episiotomies, hemorrhoids, sore nipples, and breast engorgement. Non-pharmacologic comfort measures, in addition to the normal ones, for uterine after pains. You can apply warmth to the abdomen. For perineal pain, if you want to look on box 21-1 on page 489. Nipples are usually sore because the baby has an improper latch, so you want to teach them how to properly latch the baby. And also they can apply lanolin. For breast engorgement, ice and NSAIDs help with that. Pharmacologic include your typical pain medications. Just kind of interesting to note, the first question that breastfeeding moms always ask is, will this hurt my baby? They're always concerned about any medicine you're giving them hurting their baby. So one thing you can do to decrease the effect of narcotics on the baby is to administer pain medicines immediately after she breastfeeds. And so hopefully it's mostly out of her system by the time she breastfeeds in 2 to 3 hours, that the baby gets the least amount of that medication possible. Next is promotion of ambulation. You want to encourage moms to ambulate to decrease their risk of DVTs. You also want to be mindful of orthostatic hypotension, so you want to be with them the first couple times that they get up on their own. And you want to assess the strength of their lower extremities if they've received an epidural. It's also important to promote rest. There's a condition known as postpartum fatigue that can really affect the mom's interaction with her baby and how well she's able to care for herself and her baby. If you read more in your book, you want to kind of help them manage visitors, and you also want to cluster your own care that you provide. So you don't want to go in there and fill up their water pitcher and 15 minutes later go in and give them a pain medicine, and 15 minutes later go hang an antibiotic and then follow up on the pain medicine to see if it decreased their pain. You want to cluster their care as much as possible so they have uninterrupted sleep. As far as exercise, C-section moms should be encouraged to not do any kind of abdominal exercise for 4 to 6 weeks postpartum, and all moms should be taught on how to do Kegel exercises. For nutrition, non-lactating women need approximately 1,800 to 2,200 calories a day, and if you're lactating, you need an additional 500 calories on top of that. Usually moms continue to take their prenatal vitamin, especially if they're breastfeeding, for the duration of their breastfeeding, and iron supplementation if their hemoglobin and hematocrit are low. Promotion of normal bladder and bowel function. You want moms to void within 6 to 8 hours after birth, and void approximately 150 mLs each time. So it's important that after they void, they feel like they have emptied their bladder. Stool softeners are commonly ordered, and it's important to monitor for flatus after a C-section. You have to remember moms are, kind of uncomfortable sometimes expelling flatus in front of their care providers and all of their visitors. So, it's important to make sure they get that bathroom time alone, that they're comfortable doing that. Promotion of breastfeeding. So babies should be placed skin to skin immediately after birth, hopefully whether they're breastfeeding or not breastfeeding. But skin to skin encourages breastfeeding. They should breastfeed 1 to 2 hours immediately after birth. During this time, the baby is very alert and awake, and breastfeeding is normally more successful. Breastfeeding aids in the uterus contracting. When it does that, it releases oxytocin and prevents maternal hemorrhage. Lactation suppression. Non-breastfeeding mothers should wear a well-fitting bra for at least 72 hours and avoid any type of breast stimulation. They have engorgement. They can apply ice, cabbage leaves, and take NSAIDs. Health promotion for future pregnancies in children. The rubella vaccination is given sub-Q prior to discharge if the mom is non-immune. They are given the MMR vaccine, which is the measles, mumps, and rubella, and it's important that you teach them to avoid pregnancy for 28 days after administration to protect that, so there's not any damage done to an early fetus, so they want to avoid pregnancy for 28 hours. The next vaccination is varicella, which you administer prior to discharge, and they get a booster at 6 to 8 weeks postpartum if they're non-immune. The tetanus, diphtheria, Tdap vaccine, you want to give this prior to discharge if the mother has never received it to prevent pertussis or whooping cough. It's important that any adult and all other children that are going to be around the baby should be vaccinated. So as adults and people with immune systems, they don't have problems with pertussis, so you're taking the vaccine actually to prevent the baby from getting pertussis. RH, ISO immunization. You want to give RhoGAM within 72 hours after birth if the mom is RH negative to prevent antibodies against the infant that's RH positive. There's a medication guide on page 494. Next is the psychosocial needs of the new family. The birth experience. It's important that moms review and reflect on their birth. This is especially important if the birth didn't go as planned. If it was an emergency and that type of thing, and they received general anesthesia, it's important, actually even from a risk management standpoint, but for their psychosocial needs and their just mental well-being, for them to understand exactly what happened and the outcome, and it's nothing that they did to cause it, because women just in general feel guilty about their birth if it doesn't go as planned. To promote their maternal self-image, you want to assess their self-concept, body image, and sexuality. It's important to discuss sexuality as a routine teaching. Usually moms and significant others won't bring up, when can they have intercourse and that type of thing. So you just include it in your teaching, just matter of fact. Adaptation to parenthood and parent-infant interactions. You want to assess for positive parent-infant interactions. Concerns that there are not positive parent-infant interactions are listed in a box on page 495, and you also want to screen for postpartum depression. And the last is family structure and functioning. So how well a woman adjusts is affected by her relationship with her partner, her mother, and the other older children. It will affect how she deals with sibling rivalry and unsolicited grandparent advice. And that's real important and can be real hurtful or helpful to new moms, especially if it's their first baby. Car seats didn't used to be important. Babies used to lay on their tummies to go to sleep, and now we know car seats are very important, that babies should stay rear-facing up until a minimum of age 2, and babies should go to sleep on their back, so that kind of stress, that adds stress to the new mom. Discharge teaching. It's important to know cultural diversity and what different cultures perceive as the norm, whether that's rest, seclusion, dietary restraints, ceremonies honoring the mother, or common traditional practices. Some will only eat hot and drink hot beverages because they consider childbirth a cold process. Self-management. Again, discharge planning starts at admission. recognizing any signs of complications, sexual activity and contraception. What we teach is, pelvic rest for 6 weeks, and just know that moms can ovulate in approximately 1 month after they give birth, and so if their appointment is not until 6 weeks, it is possible, if she has intercourse, unprotected intercourse, prior to her 6-week appointment, that she could find out she's pregnant at her 6-week appointment. Medications, they'll continue their prenatal vitamins, iron if necessary, pain meds and stool softeners. Follow-up after discharge. For their routine care, it's best if, as the nurse, you make their follow-up appointments before they leave the hospital. Their parents are very overwhelmed when they get home, and the last thing they're going to remember is to call and make an appointment. So if you discharge a couplet on a weekend, it's going to be very difficult to make the follow-up appointment. Hopefully you can make that on the Friday or the Monday, but if not, it's important to make sure they make the follow-up appointment. So C-section moms will see their provider approximately 2 weeks. Spontaneous vaginal delivery, 6 weeks. A breastfeeding infant will see their pediatrician 48 to 72 hours after birth and discharge, and then at 2 weeks. And formula infants will see their pediatrician at 2 weeks. So breastfeeding infants have an appointment 48 to 72 hours after discharge, and again at 2 weeks. And that's to monitor for weight gain and jaundice. Here are the key points. And here's our practice question. Postpartum fatigue is more than just feeling tired. It's a complex phenomenon affected by a combination of physiologic, psychologic, and situational variables. Which of these is not a contributing factor to postpartum fatigue? So the answer is going to be C, social isolation due to lack of visitors. So A is incorrect because physical fatigue and exhaustion may be associated with long labors or cesareans. B is incorrect because hospital routines and infant care demands such as breastfeeding can contribute to maternal fatigue. D is incorrect because fatigue is associated with anemia, infection, and thyroid dysfunction. So C is correct because well-intended visitors can interrupt periods of rest, both in the hospital and at home. Nurses may be asked to limit visitors and phone calls in order for the woman to rest. Postpartum fatigue is recognized as a risk factor for postpartum depression.